Hello everyone, and welcome back to another episode of Ask the Doctor. Today, we are discussing hip surgery, and with me is Dr. Adam Lamb, a total joint specialist with Northside Hospital. Welcome in, Doctor. To start, how do I know if I'm having hip joint pain?
So it can be difficult to know whether or not the pain that you're experiencing is actually coming from the hip joint versus another part of the body. There's a lot of overlap between the symptoms that you'll experience with things like low back pain, sciatica, stenosis of the lumbar spine, as well as hip problems such as arthritis or bursitis. And that's where having an experienced professional to help you can be so useful. So some general guidelines that I would say, and this is part of the physical exam that I do. In fact, one of the first things that will precede pain for a lot of people is stiffness. So if you've noticed that getting down to do simple things like, pull your socks on or tie your shoes, if those are becoming difficult for you, then there's a very good chance that the problem may actually be in the hip. But typically when pain in the hip does start, it usually will be felt somewhere in the front of the hip. This can be somewhere on the side, but almost always will have some component that radiates into the front of the hip. This can especially be seen with rotational activities, so twisting or pivoting on the hip that causes pain to radiate into the groin is a really good indicator that the pain may actually be in the hip. That doesn't always mean that it's arthritis, but it does typically mean that it's a problem with the hip joint. On the other hand, pain that starts more posteriorly in the buttock, especially with pain radiating down the back of the leg or pain that keeps you awake at night in the back, a lot of times that's going to have more of a low back type problem. And again, seeing a professional who can take x-rays, do a physical exam to help determine where the pain's coming from is really the first step in getting help.
What might an office visit look like?
So one thing that I feel very strongly about is that I'm here to help my patient accomplish whatever goal that they're looking for. I think a lot of times patients, when their primary care physician says it's time to go see an orthopedic surgeon, they focus on that word surgery and they immediately assume that they're going to walk in and that the first thing I'm going to tell them is that they need surgery. And what I would say is that the vast majority of the time we're able to avoid surgery for a long period of time, but regardless, I'm happy to help the patient achieve whatever goals they're wanting to achieve. And so a typical office visit would involve a patient coming in, talking to me about where they've been hurting, how long it's been going on. Maybe they've seen other doctors or other providers who have told them different things. Usually I will do a thorough physical exam. Sometimes this will just involve the hip or the knee, or sometimes it will involve also the back if I'm concerned that some of the pain may be coming from a different location. Usually some form of imaging is involved most of the time. That's just simple x-rays, and we can learn a lot about the structure of the hip or the knee and whether or not there's arthritis and how advanced it is just from that. And then from doing that, we can formulate a plan together to determine whether or not surgery might be the best option at that time or whether there are some other things that we could potentially try.
How do I know if I need hip joint surgery now or if it can wait?
I think the key to answering that question is recognizing, again, that I'm here to help you, the patient. And so whatever goals you're trying to achieve, I can help make that a reality. If it's just living a better quality of life without surgery, we can do that. And of course, if it comes time to consider surgery, I'm happy to help with that as well. A lot of that decision is based on things that you may have tried in the past. So if you've tried medications, if you've tried injections, other conservative options, physical therapy, if those things no longer provide the relief that allow you to live the active lifestyle that you want, then that's where a lot of times we'll start at least having the discussion about surgery.
What does hip replacement surgery involve?
So this is an actual example of a hip replacement, and it is a fairly complicated procedure that on one hand is very straightforward. Most people understand the concept of a ball and socket and of a ball bearing in the mechanics world, and that's essentially what we do with hip replacement. We take a metal shell and use that to replace the patient's natural socket, and then we have a ceramic ball with a piece that goes into the thigh bone, And when placed together, again, it essentially just creates a ball bearing with no arthritis and excellent range of motion, and these are tremendously successful. And so they work very, very well. And there are some important details about how we do the hip replacement, and those things are obviously very important. It's not so scary. No, these are typically procedures that we'll do in 30 to 45 minutes in the average patient. In almost all cases, we have the patient up walking the same day, usually within 2 or 3 hours of surgery. They're allowed to put their full weight on the hip right away. And the overwhelming majority of patients actually are going home the same day to recover at home in their own bed, which I think is a huge advantage.
What are the risks of hip replacement surgery?
It's a great question, and it's certainly something that needs to be considered. Hip replacement has come a very long way. It's a very safe procedure. It's very well tolerated. Even in patients with some other medical risk factors such as heart disease, COPD, diabetes, a lot of times because of our new advanced techniques, we can do these in a very safe way, but there are still some risks that are absolutely unavoidable. Things like infection, the possibility of nerve injury or of the hip dislocating. Fortunately, those things are exceptionally rare, usually less than 1%, and some things that we do to help further lower that risk. Obviously making sure that the patient is as optimized as possible. For patients, for example, who have elevated blood sugar, we want that under control. But then also making sure that we're using good sterile technique in the operating room. We use body exhaust suits to keep all the air away from the patient. So a lot of things that we do to try to minimize that risk, but it's never zero, and it's important that patients understand that.
What can I expect once I've recovered from hip replacement surgery?
So hip replacement, almost any doctor would agree, is probably one of the most successful surgeries, not only in orthopedics, but in all of medicine. And the way we define that is really in terms of how the patient looks at it. A lot of times we'll use what's called the forgotten joint score, which literally means the number of patients that by a year forget they ever even had a hip problem. And the results for hip replacement are unbelievably good, higher than for really any other joint we replace. And I usually tell folks that they can expect probably 90 to 95% complete satisfaction after they've had it. Now, there is a recovery period. Patients a lot of times will ask me, what's the downtime? There really is not a true downtime. I like patients to be up walking the day of surgery. They can even climb stairs. They'll be slow, they'll be a little unsteady, and they'll need to use a walker for a period of time. But they are able to take care of themselves and meet all their basic daily requirements for taking care of themselves. Full recovery, meaning the ability to return to work, or especially the ability to return to an active sport, for example, like playing tennis, that's probably more on the order of 3 to 6 months, but it's highly dependent on the person. Some of that depends on how healthy and active they are before surgery, how long they're willing to work with physical therapy, and then a lot of it's just what their pain tolerance is.
Why should a new patient choose Total Joint Specialist from Northside Hospital?
So one of the things that makes Total Joint Specialist unique to other practices is that each of the physicians here, the surgeons here, specialize solely in hip and knee replacement. So we all have specialized advanced training in advanced techniques for hip and knee replacement. So we're capable of not only doing the simple routine hip and knee replacement, but of even doing the complicated revision type procedures. Those are all things that we have years of combined experience doing. We offer trendy techniques, robotic surgery, approaches such as the anterior approach for hip replacement, which is part of the reason that we can offer same-day hip surgery. It's also part of the reason that the recovery time for hip replacement has dropped to what it is. But I would say what really makes us unique is the fact that this is all we do is hip and knee replacement.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.